Good morning, everyone. Welcome to our Monday edition of our COVID-19 media briefing. I'm Carrie Schutte. I'm a spokesperson for the Shasta County Health and Human Services Agency, serving as a public information officer for this event. I wanted to start with our numbers. We have, for the fourth day in a row, we had no positive tests. We've got still holding at 24 confirmed cases, with 671 negative lab tests. We had 5 yesterday. Of those folks, we've got 4 that were travel related, 13 person to person, 1 community acquired, and 6 still under investigation. We've got 15 people on isolation, which means that they are sick patients. And then we have 53 under quarantine, which, as a reminder, means that those are people who generally have had close contact with a patient and are not sick, but they are on quarantine for 14 days to prevent against spreading the disease. We have 6 people who have recovered, and we have 3 deaths. I'd like to start. We're going to switch things up just a little bit today and kind of streamline our process. I wanted to introduce to all of you the folks who are on the administrative side of this response, and we have Chief Brett Gouveia from CAL FIRE. We have Donnell Ewert, the Director of the Health and Human Services Agency, Sheriff Eric Magrini, and then our Health Officer, Dr. Karen Ramstrom, and then our Shasta County CEO, Matt Pontes. And I would love to open it up for any of you who have anything new to share with us this morning.
I'll jump in real quick just to say, hope everyone had a great Easter. I just concluded a conference call with the 2 chiefs of police and myself, Chief Bill Schuler and Chief Mike Johnson. In that call, we were talking about compliance with some of the businesses, and there were a few that we had identified as possibly holding out or not coming into compliance. And I'm happy to say that through this weekend, those businesses have come into compliance. And I know that probation is still working on the education component and working with those businesses and taking those complaints that come through the email link that was provided. But so far, we're doing really well with businesses being responsible and people listening to the caution that's being put forth.
Excellent. Thank you very much for that great update. Anybody else from that group of folks?
Yeah, this is Karen Ramstrom. I just want to comment on our decrease in numbers. I think it's time to congratulate ourselves on doing a good job with social distancing, and really just to get Sheriff McCready's point, having individuals and businesses come along, doing the right thing, trying to protect their workers and the public. And it's not a time to be ease up yet, though. I think we are benefiting from the hard work that we've been doing over the last couple of weeks to increase our social distancing and environmental cleaning measures. And so I just wanted to congratulate everybody on that and let you all know that we need to continue having this slower rate of infections is going to allow our healthcare partners to be able to respond and provide, have the capacity to care for those who need it, and also allows us to continue to work on some of our challenges with regard to testing capacity and issues around, making sure that we're really geared up to do good containment measures in terms of isolation, quarantine, and contact tracing. So that's all I had today. Thanks.
All right. Thank you, Dr. Ramstrom. I know that each of our hospitals did indicate that today they all have new updates from last week, and so I will introduce them next. We've got first we have Robert Folden from Mercy.
Good morning. Thank you. Hey, before I give our announcement, I just want to give a shout out to Mallory's. We had a pop-up display for our staff over the weekend, and it brought a lot of joy to many people as they drove up to the facility. So again, I love the creativity of a lot of the businesses here in town to just support everyone. So our big announcement is that we finally received our test kits for our testing platform. So here at Mercy, we use the Cepheid Gene Expert test platform to do many of our viral studies. And we just received our supply to start assisting with COVID testing. So that test is something that we'll be doing 24 hours a day, 7 days a week. It takes about an hour to get test results. But I have one caution, and that goes back to supply chain. So while we do have the testing available, it was delivered in low quantity. So for the next few weeks, we'll have a low quantity of testing capability, but it's going to allow us to help SRMC and mayors or the county be a backup for testing. And really what makes it super important is that 1 hour turnaround time. So now we can truly better manage our protective equipment within the hospital, knowing whether someone is positive or negative. So that's it for me this morning.
Excellent. Thank you. That's great news. Mark from Shasta Regional.
So good morning, guys. So no real updates for our side of things, but I really did want to just point out that Mercy's ability to get this rapid tester is really a game changer for us. We've been able to do about 2 tests to send over to them for very high-risk patients that we needed a rapid identification of if they were positive or negative. And because we were able to do that testing, it really has enhanced our ability to care for the patients in the community. So I just wanted to give a big shout out to Mercy for having this option and just thank them for cooperating with us.
Awesome. Thank you. I know Val had an update to share as well.
I do. I'm Valerie Lakey from Mayor's Memorial Hospital District. And as long as we're shouting out, I just want to say we here at Mayor's really appreciate Mercy and Shasta Regional for being our larger partners and helping us out with a lot of things. It really helps us up here in this rural part of the county. But I wanted to touch on something a little bit different. I know there's a lot of news about skilled nursing facilities, and at Mayor's, we do have a 90-bed skilled nursing facility. And I just wanted everyone to be aware of the fact that since the beginning of this, our SNF has been a top priority. We took a very early lead in implementing some processes. As far as no visitors began on March 6th, we started early employee screening. We suspended communal activities in the skilled nursing facilities, and then implemented some other things to keep our residents social and in communication with their family members. But last week, I believe it was on the 10th, that the governor came out with some steps to protect the residents and the employees of these skilled nursing facilities. So daily now, we receive a phone call from the California Department of Public Health, and we are submitting answers to a whole list of questions, and that's giving the CDPH an opportunity to see where we might have problems brewing, what we need to do, how we can fix them, and make sure that we are doing everything that we can to protect those residents and the staff that's taking care of them.
All right, thank you. Any other input from our hospital and healthcare partners before we open to questions?
I guess just one other thing, on a good note, we had our 3rd patient discharge. So our 3rd positive patient discharge. So that's, again, we're trying to look for ways to celebrate. And to us, that's huge.
Yes, absolutely. Thank you. Okay, so we are ready for media questions.
I have one for Robert.
Okay.
That's great news about the rapid turnaround test kits you've received, but I have 2 questions. One is, how many is a low quantity? And number 2, what will be your turnaround time to receive additional tests like that?
So a low quantity, I think our initial order, now we ordered 3,000, but our initial order that we received was less than 100 test kits. So after we did all of the validation that we're required to do, I think we have roughly 50 or 60 test kits to help the county with testing for the next week or so. And then every week we expect to see again, about that same quantity of supply. So this isn't a supply that's going to allow us to do widespread testing, but it is going to allow us to be a backstop for all of the great work that the county has done to date.
Thank you.
Other questions?
This is Mike Chapman from the Record Searchlight. And this is for Sheriff Magrini. The Judicial Council is following Governor Newsom's precautions for telling counties to reduce jail inmates. And you touched on this last Friday. Did you have any updates on the number of inmates that are going to be released today from the jail?
Yes, Michael. We worked over the weekend. I know that the DA's office worked hard as well. Stephanie Bridget. We reviewed 47 inmates that might fall within this category. Of those 47, I got an order from the court late Friday afternoon for the release today of 13 of those inmates. 26 of the inmates we feel, and the courts and the DA feel, are ineligible, and it'll be on the defense to make a motion to have any one of those cases heard. And then the remaining 8, the DA feels are not, do not meet the exemptions, and they will be heard tomorrow in court. So 13 as of right now. The way the list exists is 13 will be released later today by 5 p.m.
Okay, thanks. Do you know what percentage of the jail is full now? Like, what's it down to? Like, it was at 77% a while back.
I did not have time this morning to run our population numbers.
Okay, thanks.
I have a question. Anna Torrea here from Action News Now for Sheriff Magrini. So I just want to know that how are you guys able to decide who gets released, and like what kind of people are being released? Are they like low-level offenders? Like, how does that happen?
So with the bail reform, for lack of a better term, the zero cash bail, not to be confused with no bail, but zero cash bail, we went through our list of inmates through classification. We provided that list to the district attorney's office, and with communication between the DA and the courts, established the list of what we have before us today. I will be releasing that list later today once it gets finalized. I just want to make sure that there are no errors, and I don't want to put any names on there erroneously. So once that list is finalized, I will be publishing it later today.
Any other questions?
I've got a question for Dr. Ramstrom. I interviewed a local doctor today. He's not an immunologist, but he's got a lot of experience with immunology. And he feels that the county is being too conservative, that this should be one of the first areas of the state to relax the restrictions rather than one of the last, as you mentioned last week, I believe. Can you comment on that?
Sure. So I'm not sure what he is basing his recommendation on. I guess I would just say that I think that we're really benefiting from implementing the stay-at-home order early. There was an article that just came out today from the CDC that I only had a chance to skim this morning, but you know, we weren't in a position where we were having to do catch up, like already having an increasing number of cases when the stay-at-home order was implemented. Areas where that was the case, you know, it didn't help as quickly as it could have, or to the degree that it could have. So, you know, I think that it's you know, it's the conundrum of prevention, right? You don't really know exactly what you're preventing, but you are taking these steps to prevent what your theory and your data and your science tells you could be the case. And so that's where we are. I think that this is not a situation where we want to take this lightly. It's not a situation where we want to try and be more relaxed just because we think maybe things are trending down. It's something we're going to have to be very thoughtful about our decision making about releasing or loosening any of the restrictions. Because, you know, we have an opportunity right now to just make sure that this outbreak in Shasta County trickles in rather than overwhelming our healthcare system. And so that's where we are. I'd be happy to have a conversation with him, but that's my thought. Those are my thoughts today.
I think he was basing it on the per capita rate. That's one of the reasons anyway. But do you still think that Shasta County would be one of the last, or this would be an area that would keep the restrictions longer than most other areas?
Well, I think longer than the urban areas that were impacted earlier compared to other areas, I can't say. And, you know, I think the per capita rate is tough because the amount of testing is varied across jurisdictions too. So it's not an exact science right now.
Thank you.
Other questions?
Hi, Anna Terea here again.
Oh.
Sorry, Action News Now. I just wanted to follow up on the jail. So what are plans for virus containment, at least? Like if an inmate were to get the coronavirus, what are the plans there? For at least, are there isolation rooms, and what are the plans for staff?
Yes, we have specified cells that are specific isolation cells that we can put somebody in if they do test positive. Because our bookings are down and our jail population is down, we were able to dedicate a pod of the jail as another mechanism to isolate inmates that may test positive. So we have both of those contingency plans in effect.
Okay.
Other questions?
Yes, Dr. Ramstrom. Since this virus has a 2-week incubation period and we're essentially seeing a window of 2 weeks ago, are you reviewing what was being done right 2 weeks ago for what we should be doing going forward with this few days of no new cases in mind?
Yeah, it's a good question, you know, and I think the information is skewed somewhat just because we aren't in a normal circumstance as far as testing everybody who we might be concerned about for a variety of reasons. And so I think there is something to where when the stay-at-home order was implemented, and like you said, you know, we're just 2 or 3 weeks out from that. And so more than likely, many of the cases we've seen here in Shasta County were exposed before or right around the time before we were really doing that very rigorously. So now I think we have to monitor where we go from here and see how this unfolds. But yeah, for sure, we're kind of looking at that and looking forward to sharing a little bit more of our projections and modeling later this week too, which I think will provide a little bit more context for some of those discussions.
Other questions?
So I have another one.
Okay.
There's got to be people that left Shasta County over the weekend for Easter, and then when they come back, you know, those are against recommendations. But when they come back, do you have suggestions for those people? Like, should they quarantine themselves, or any comment on that?
You know, right now I would say anybody who leaves our county, you know, for non-essential purposes where there might be protections built in, I think it is not a bad idea that they should actually stay close to home for a couple weeks and monitor for symptoms and avoid contact with others. We really highly recommend people avoid non-essential travel. We know that non-essential travel has contributed to our cases in our county, and it's not recommended. And you know, we hope people take that seriously.
Great, thanks.
I have another question again for Sheriff Magrini. So I just wanted to know, what are the procedures right now for inmates who are in jail? Like, are they currently being tested? Yeah.
So we do have a screening process for anybody that comes before or brought into the facility. We have a medical provider that we contract with for inmate medical services. And we have a questionnaire and a medical screening process for anybody brought in.
And just to follow up on that, you said the person that you have a medical contractor, so this isn't with the county, it's an outside source, correct?
We have a pre-existing, long-standing contract with an outside medical provider to do services for medicals, to provide medical services within the jail.
Okay. Thank you.
Any other
I'll
questions?
have another one. I'm not sure if this is against the social distancing guidelines, but have you received any complaints about Airbnb owners renting from people out of the county? We've heard in one neighborhood in Reading that neighbors are upset that this has happened.
So say that again, Airbnb owners renting from outside. Do you
Yeah,
mean?
yeah. We've heard, we got a
Here.
complaint from some neighborhood upset with an Airbnb owner renting to someone from out of the area, and they don't think
Yeah.
that's right. I wonder, would that qualify as a complaint, like a business complaint?
It would, and as we're looking at where we're going locally from here, and, one area of concern is these short-term lodgings. It's not recommended right now for people to come from out of the area. Certainly if people have a second residence here, that's their home, and they should be able to come and stay in that home. But we are also, even in those circumstances, recommending that those individuals stay at home for 2 weeks and monitor for symptoms and limit contact with others. So you're right, it's not recommended. I'm not sure the quantity of those complaints that we've received. Haven't heard about that for a while, but I agree it has been of concern and something that we're looking at, moving forward, what we want to do here locally for any of our own local restrictions on movement.
Okay, thanks.
Any other questions?
Hi, yeah, Anna Terea here again with Action News Now. Again, this is for Sheriff Magrini. For the people who are about to be released today, are they being tested? And if so, are you going to be holding them pending their results?
So without looking at the duration, most of these people have been in custody for a set amount of time. So for all intents and purposes, and lack of a better term, they have been under quarantine. If they displayed signs and symptoms, and we will definitely test and analyze them before being released. But we have no reported cases of COVID entering our facility. So therefore, everyone within the facility should be in good health in relation to that.
I do have another follow-up for that. I don't know if you answered my question, but how are you able to keep your deputies and your staff in the jail? How are they being protected during this time?
We are working with public health. We've analyzed the CDC regulations, and we're providing the proper PPE for the persons working in the jail and making sure that they're protected as well.
I have a quick follow-up to Mike Chapman's question regarding Airbnb and VRBO. So, Dr. Ramstrom, would you say that people who have current bookings as Airbnb or VRBO hosts actually cancel those bookings of people coming from outside the area that may have been in place for a while? I know I actually have a couple of situations like that myself.
For sure, the governor's stay-at-home order includes the recommendation for no non-essential travel. I would consider that non-essential travel unless the person happens to be coming maybe for an essential business, in which case then, that would be handled differently. But yeah, they should not be booking from out of the area right now.
Thank you.
Are there any other questions?
Yeah, hi, Anna Torrea here. Just wanted to follow up on some questions with the jail situation. The inmates who will be released today, will they be monitored?
Monitored once they're released?
Yeah, once they're released, like, are they going to be supervised, or are they just going to be out and about?
They will be released into the community.
And then just to also follow up with that, can we expect more inmates to be released?
I do not anticipate releasing anybody that the court doesn't force me to release. We are not doing releases from our jail. The people that are booked and will be held accountable, and until the courts tell me to release somebody or their sentence is served, that will be my stance.
And then, sorry, one more follow-up question to that. Can we see, with these inmates who are being released, can we see at least some crime increase across the county? Because I know Reading saw a decrease in crime during the shelter in place.
With the new bail schedule that's been given to us by the Judicial Council and has filtered through our Shasta County courts, I'm fearful that crime could potentially increase due to the lack of the ability for us to hold people accountable.
Any other questions? Okay.
Yeah, I've got a question.
Go ahead.
Eric, this might be a question more for the DA's office, but you might know. I know that they are suspending preliminary hearings for anyone who does not waive the right to a speedy trial, or except for those who don't waive the right to a speedy trial. Is there a problem with people not waiving time and cases building up as a result?
I'm going to defer that to the district attorney. However, due to the suspension of court proceedings and the delays based on COVID restrictions, I think there will be a backup affiliated with that within the justice system.
Okay, any other?
Well, I have one more for the hospitals. Of the patients, of the positive COVID patients now, is there any way to have a breakdown, like how many are at SRMC and how many are at Mercy or in the ICUs?
Yeah, we typically don't speak too much of our census. I think we've said all along, we do have 2 patients in our ICU today, but typically, Mike, we try not to go into that detail.
Yeah, I agree.
This is Donnell. I can, we do accumulate data, and I can give you the totals for Shasta County as of yesterday, not specifically by hospital. And as of yesterday, we had 5 COVID positive patients in the hospital, 3 suspect cases, and 2 of the 5 were in ICU.
All right, thank you. That's all I have got.
Okay, any other questions?
Good.
Okay. All right. We will be sure to update our Facebook pages and social media as new things come up that need to be shared with all of you. Otherwise, we will see you all again here on Wednesday at 11 a.m. Thank you very much. Have a great day.